Doctor, I've heard that type 2 diabetes can be caused by many different factors, but what exactly are they? A friend of mine recently said things like, if your parents have diabetes, you're at risk too, or lack of exercise is the worst. Honestly, I'm a bit confused.
That's a great question. Type 2 diabetes doesn't have just one cause, it results from a combination of factors, including genetics and lifestyle habits. Let me explain the 6 main causes of type 2 diabetes in more detail.
Please do. I'd like to see which ones might apply to me.
The first one is genetic predisposition. For example, it's been found that Japanese people tend to have lower insulin secretion compared to Western populations. If someone in your family has diabetes, your risk increases 2 to 4 times. So even just being a little careless with your diet or physical activity could easily raise your blood sugar. Some people may also inherit genes that reduce insulin production or make the body less responsive to it.
I see. My parents don't have diabetes, but my grandfather did. Would that still put me at risk?
Yes, even a family history from your grandparents' generation can have an effect. But that just means it's all the more important to maintain a healthy lifestyle, which can delay or even prevent the onset.
Got it. Let's move on to the second cause.
The second cause is the accumulation of visceral fat. When your waist size increases, it's not just a cosmetic issue, it can be a sign of internal fat building up. Visceral fat releases inflammatory substances that interfere with insulin's ability to work. Even if your BMI is within a normal range, people who carry more fat around the abdomen are more likely to develop diabetes.
My weight isn't that high, but I've noticed my belly getting bigger lately. Should I be worried?
That sounds like what we call hidden obesity, which can be just as risky. Increasing your physical activity and reducing visceral fat can help stabilize your blood sugar. Now, can you guess the third cause?
That would be lack of exercise, right? We touched on that earlier.
Yes, exactly. When you don't use your muscles regularly, they consume less glucose, and blood sugar tends to rise. Take people with desk jobs, for example, they may sit all day, even after lunch. Muscle mass declines if you don't use it, and that weakens insulin sensitivity. You don't have to do anything extreme, even brisk walking for 30 minutes several times a week can make a big difference.
That describes me perfectly. I work at a desk all day. So even standing up once every hour can help?
Absolutely. That alone can be a good start. The fourth cause is diet. Diets high in fat and sugar, combined with low fiber intake, can cause rapid spikes in blood sugar and put extra stress on insulin. For instance, eating donuts or sweet bread for breakfast, ramen for lunch, and fried food with beer for dinner, this kind of diet definitely increases the risk. The key is to eat fiber-rich foods like vegetables, seaweed, or mushrooms first, and also to limit the amount of carbs per meal.
I've definitely gone through periods where I ate like that. What's the fifth cause?
The fifth includes other modifiable factors such as sleep deprivation, stress, and smoking. For example, if you stay up late because of work, your meals get pushed back too, and late-night eating becomes a habit, which worsens visceral fat accumulation. Smoking damages blood vessels and worsens insulin resistance. Stress increases cortisol levels, which also raises blood sugar, so these factors shouldn't be overlooked.
I didn't realize sleep and smoking could be connected to diabetes. There's a lot to be careful about. But I'll try to start fixing what I can.
That's the right approach. You don't have to do everything at once, small steps are fine. Finally, the sixth cause is non-modifiable factors. For example, aging is something no one can avoid. As we get older, we lose muscle mass and insulin sensitivity decreases. Some people may also be born with a tendency to produce less insulin, or those born with low birth weight might face a higher risk of diabetes later in life. These things can't be changed, but addressing them early makes a big difference.
I see. So even if there are things I can't change, improving my lifestyle is still key.
Exactly. Reviewing your diet, exercise, and sleep habits is the most important thing. Genetics and aging can't be controlled, but by managing the factors you can control, you can delay or prevent the onset and progression of diabetes.
That makes a lot of sense. Knowing the 6 causes really helps me figure out what I should work on. I feel like I finally have a clear goal for prevention and treatment.
That's a great mindset to have. Trying to change everything at once can be overwhelming, so start with what's manageable. And if you ever feel unsure or need support, don't hesitate to reach out.
Thank you so much. I'll start by reviewing my diet and getting more exercise.
That sounds like a great plan. The key is to stay consistent and not rush. Let's work on this together.